One way to develop therapies for people with very rare mutations is to use a technique called theratyping. Theratyping is a way to test really rare mutations and their responsiveness to drugs in the laboratory. We have over 650 mutations that are now being tested by theratyping in 3 labs around the country. If the theratyping results are positive, then those results can be submitted to the FDA by the drug developer for approval of those mutations to the label. That will allow people with those mutations to benefit from those drugs. So a nonsense mutation, or otherwise known as an X or a stop mutation, is a mutation that prevents synthesis of CFTR by putting a stop sign in the genetic code. So as the protein is being made, the synthesis is terminated prematurely, and the full-length protein is never produced. Modulators will not work on nonsense mutations because they only act if the protein is present in the cell. And in a nonsense mutation, there's no protein for them to work on. Therapies for nonsense mutations are designed to read through the stop sign, make the full-length protein that then allows the CFTR to go to the surface and perform its function in chloride transport. And there are a couple of strategies to develop nonsense therapies. Small molecules can activate the machinery and allow the ribosome to read through the nonsense mutation. Small molecule screening is much like the technique that was used for modulators. Random libraries of molecules, hundreds of thousands and even millions of molecules, are added to cells. And then with every single molecule that's added, we look for the sign that in the case of a nonsense mutation, the protein is now being synthesized and functional. tRNA is an approach where a particular type of molecule that's made in the cell, called a transfer RNA, is added to fool the protein machinery, again, allowing synthesis to proceed beyond the stop sign and make full-length protein. I think the most exciting thing in CF research right now is the pace at which these discoveries are moving forward. We have an opportunity here to take these new advances and apply them to CF and really make a difference for people with this disease.